Good day, everyone. My name is David, and today I'll be talking about how to correctly make a bed. Before my video starts, I just want to mention a few guidelines that we're supposed to know when making a bed. And the reason I'm mentioning these guidelines are because certain parts of my video do not follow these guidelines, which I apologize for. Okay, the first guideline is to use good body mechanics at all times to prevent back injury. The second guideline is that you work on one side of the bed first. So, for example, if you start working at the head, you finish at the head, and then you proceed to the bottom of the bed. And then if perhaps you finish at the bottom of the bed and you see there's certain adjustments that are needed to be made at the top of the bed, then you can proceed. And then you make sure that the bottom sheet and then the top sheet are smooth and unwrinkled. You would see that in my video the bottom sheet and the top sheet were wrinkled. However, realistically they are not supposed to be wrinkled. Reason being, wrinkled bed linens cause discomfort, and they cause breakdown of skin, especially for patients who are confined to bed regimens, strict bed regimens as well. And also, you must follow the careful positioning of the head for foot of the bed and the numbers of pillows to be used and the types of pillows to be used. In my video, I didn't have pillows, so pardon that as well. Now I'll let my video play. Thank you.
Good day everyone, my name is David and today I'm presenting on how to lay in a hospital bed. The first step is, in the case of laying a hospital bed, you can use two techniques. You can lay with an inner sheet that covers the bed, and then you lay with the outer sheet that covers the inner sheet. In my case, I have limited material, so I'm making do with what I have. So the first step is to take the inner sheet and you lay it like this. Now normally with a hospital bed it will be much more wider and you can tuck it in. So you bend the edges and you tuck it in. So once the inner sheet is settled, pardon this, then you take the outer sheet and then you take the outer sheet and then you lay the outer sheet on top as well. And then you hem the edges and make sure the sides are all tucked in. Normally, you can make different types of corners, but I'm very limited with what I can do here. So thank you for listening. That's the end.
In conclusion, I'd like to add that after laying the bottom sheet and the top sheet, it is very crucial to make a mitered corner. Some people prefer to make a square or a box corner. The reason why making this corner is so important is because it reduces the risk of contractures. I'd break it down. Contracture is when there is a tightening of the muscle of the skin. It usually occurs in our fingers and in our legs. And the risk of having contractures increases when someone is confined to the bed. And in this case, we're talking about our patients. Now, we have to implement everything possible to reduce the risk of this happening, which is why we have to make a mitered corner. So when we make a mitered corner, the bed linen becomes so smooth and it feels comfortable for the patient. Unlike not having a mitered corner, the bed is kind of wrinkled, which causes discomfort to the patient. But with a mitered corner, everything is crisp, everything is sharp. The bed linen is smooth and comfortable for the patient. Also, with a mitered corner, the bed linen holds for much more longer, in the sense that it doesn't become loose, it doesn't pull out of the corners or the edges quickly, and in the long run this aids comfortability for patients who are confined to bed rest. Simply put, a mitered corner can be made by taking the loose bed linen you have, right, and with one hand you make a triangle. I'd advise you make triangle with the bed linen on your right hand, and then you take the remaining loose linen and then you tuck it under the bed, and then with the triangle you've made, you kind of pleat it into the edge of the bed, so it kind of looks like what we have here in the image. I'd also finally like to talk about the pillows. It is necessary to put pillows. Unfortunately, I did not have pillows in my video, but you put your pillow in the pillowcase. You make sure that you align the pillow with the pillowcase well, and it is without crease, and you put it at the head of the bed for the patient. After this, I think you have successfully and correctly made a bed for a patient. Thank you.